The South African Medical Association is urging all South Africans to get jabbed so we can overcome the coronavirus pandemic. This follows the Health Department's announcement of the new contact tracing and quarantine as well as isolation protocols. SAMA says government must consider that mandatory vaccination is necessary. The Council's vice-chairperson, Mvuyisi Mzukwa, joins me now live from Durban to discuss this further. Mr. Mzukwa, good afternoon and Merry Christmas. Now, first, just for the benefit of those who might not be clear on this or missed it, talk to us about your understanding of the new contact tracing and isolation protocols.
Good afternoon to you and to your viewers. Thanks for having me on your program. We know that this advice has come from the Ministerial Advisory Committee on COVID-19, where it was suggested that it is now time to abandon quarantine and contact tracing. Though some of us would think that this should have come a little bit earlier, because we know that we have lost a lot in terms of the economy, and also this has put undue pressure on the healthcare facilities, especially those primary healthcare facilities. So I think we welcome what has come out from the Ministerial Advisory Committee.
But would these protocols, amended or revised protocols, not go hand in hand with a significant number of vaccinated individuals in the country?
Yes, that's the case. But also, you must recall that in the Ministerial Advisory Committee, they also have said something about the surveys that have been done, that have shown that there's also natural infection that has been considered. In some of these surveys, this natural infection has covered more than 80%, of the samples that were taken. So on top of the natural infection, there's vaccination. We know that we haven't gone much in terms of vaccinations, but the exposure naturally is enough, for us to abandon some of these restrictions.
And then overall, in terms of vaccination itself and the hesitancy, do you think the health department has fared well or not so well this year?
Well, we know that it took time for government to start the rollout because of many different logistics, but also it took time for them to negotiate with the manufacturers. But we know now that there's also hesitancy that has also been caused by government itself, because you must remember they isolated some of the important stakeholders in terms of vaccination rollout. For example, the general practitioners were not given a space to assist with this. But on top of that, you find that on weekends, it's only now that we started seeing people opening on weekends and all those things, to allow people to access vaccination sites. But besides that, I do think many people have not been educated. There was no time to explain to communities, before we give vaccines, in terms of explaining to them what it means to be vaccinated and what are the side effects. What should they expect, all those things. You can't just give a jab without explaining those things. It happens naturally in clinical practice.
So what do they need to do in the coming year insofar as communication? Because we know there are a lot of theories that are flying around even on social media and sometimes in communities. What does government need to do to ensure that the correct message reaches ordinary citizens?
Well, they need to use all languages. That's the first thing. People must read these things in their own languages, but also they must use user-friendly methods of communicating, especially to the youth. You can't use the old methods when we are dealing with the new generation. But also consider stakeholders. There are people who are very influential in their societies. Like, for example, the pastors and traditional leaders and all those things, all those people. It's important that, government should not only use those people when they go and, garner support for votes. It's important that they talk health to those people, and those people can assist with their influencing power to get everybody tested and vaccinated. So it's important that we don't forget those stakeholders.
No, I think they've learned their lesson, particularly with the religious community, because they are very influential, and we know their position now around vaccination itself. So perhaps in 2022, it would be beneficial to engage the religious community and speak to the leaders to try and get that message across. But thank you very much. That was Mvuyisi Mzukwa, the summer vice-chairperson.